This is Unit 1A, the role of the pediatric nurse, family-centered care, and cultural considerations. There are major concepts in pediatric nursing. This is just going to give you kind of an overview of pediatric nursing as a whole to kind of get you thinking about the course and about pediatrics in general. Child certainly is birth to adolescent. Family is a child rearing unit, whatever that may look like. And health is the physical, mental, and social well-being. Concept of the child, I would recommend memorizing these. You won't be tested on them. I'm not going to test you on direct memorization. However, it will help you throughout the course to know an infant means they're less than 12 months old. A toddler means they're between these ages, so that you can answer questions appropriately based on their age. We know that, and I try to honor this, that if you're going to be tested on NCLEX, you're most likely on pediatrics, you're most likely going to be tested on growth and development, and this is at the heart of growth and development, because you need to know that if they ask you a question about a preschooler, that they're 3 to 6 years old, as opposed to, a 2 to 4 year old or something like that. So I would recommend memorizing these for your own good. They are dependent on others for care. They do develop independence throughout their childhood, certainly throughout adolescenthood as well. And so by the end of pediatrics, hopefully they're independent. There are still definitely some adult that are not fully independent. Sorry, just got an email. This used to really bother people when I worked in the pediatric ER, that they are not little adults. It doesn't bother me as much, but it is important to realize that an adult has gone through or should have gone through all of their appropriate growth and development phases, and these children have not. So no, they don't think like adults in terms of pain, and no, they don't respond to situations like adults should. So they really are not little adults. They are their own entity. And again, knowing which stage in growth and development is important in providing care and education for them. And then each child is unique, just like each patient is unique. Pediatric healthcare there's so many opportunities out there. It is important that all children certainly have a primary care doctor. They all need services for health promotion, health maintenance. If you just think about immunizations, they need services for that. They probably are going to get ill many times throughout their childhood, so they'll need services for that. It's important that they see a doctor to make sure that they are meeting their milestones, because if they are not meeting their milestones, early intervention has been proven to almost counteract them not meeting their milestones. But if it's caught too late, then often it's too late to prevent it from having a drastic effect on them later in their life. And then obviously some children need specialized care, but not all. Role of the pediatric nurse. You can read this. I'm not going to read it to you. It is the role of a nurse in any adult place as well. I will say I feel like the biggest difference between an adult and a pediatric nurse, I feel like in pediatric nursing, there is much more of a role of an advocate, because I used to always say in interviews and cover letters that I have spent my time caring for the voiceless, because children cannot always voice their concerns and voice that they're having pain or what they need. And so you truly get good at recognizing what they need, and then it's up to you to communicate to the doctor or social work or psychiatry or whoever you're working with, the interdisciplinary team, what they need. So I think that pediatrics is a unique opportunity to be a huge patient advocate. And you also need to be able to effectively care for children based on their developmental level, not just their age level, but also their developmental level. So that's a little different than adults. The role, these next two settings, I'm not going to read to you. Pediatric nurses are everywhere and can work anywhere they want to work. There are a lot of opportunities out there for them. I will say I do think it's important to have an actual physical RN in the school. I know that's something our countries and surrounding counties are kind of dealing with, but I think it's a huge education opportunity as well as an opportunity to respond to emergencies. So I do think that school nurses are often overlooked and underappreciated. Family-centered care. This is really where healthcare is, focusing right now. It's kind of interesting in the book. It said that nurses have always realized that the family was important, but it wasn't until we got everybody else on board that they developed family-centered care and realized that family was important in caring for a child. So it's interesting that not that long ago, people didn't think families were important in caring for children. So that's just a little history lesson. It is a mutually beneficial partnership, and you certainly, as the nurse, want to promote family-centered care. This is the role of the family. You can read it. It's the role of the family in any family. These family-centered care, now, I'm sure, throughout life and throughout your practice, that there are all different kinds of families. The definitions are on pages 19 and 20 in the book, or you can Google them. I don't expect you to know the definitions, but I do expect you to recognize that families look very different today than they did 50 years ago, and I think they're going to continue to look more and more different, and we as healthcare just accept it, and we work with whoever the child calls family, because to them that is what's important, and it's important to us as well to work with them. There are a lot of contemporary forces that are currently influencing family. They're constantly changing in healthcare, which can be frustrating for families. Changing in the status of women, so think about women working more and more and focusing on their careers, but still having families at the same time. And so that does have an impact on the family. It doesn't necessarily mean it's negative, but will have an impact on that child. That child will probably be raised by somebody else, or not raised. They will be taken care of during the day by somebody else or a daycare setting. And so it just changes the dynamic of the child a little bit. Violence certainly is influencing families, unfortunately. Violence in Richmond, if you think about all the shootings in the East End that are going on right now, children have been involved, and children are witnessing these shootings and are living around these shootings. And so thinking about how that is going to impact them long term. When you're a child and you're trying to figure out your own safety and really ground yourself, if you are constantly exposed to violence, you may not ever have a sense of safety, which is really sad. The media is what it is. Immigration, there have been a lot of changes in the law to immigration recently, and I'm not going to get political, but just think about how it's affecting families if, the mother and the child are over here and the father is in Guatemala, and they're waiting for a visa for the father to get here. So that child is being raised by a single mother, where if the father was allowed in, then, they could potentially, the child could be raised by two parents and could potentially be raised in a more secure financial setting. But again, not getting political, just think about how it affects the families and how it affects the children, because it's all related. I did change this, just so you know, the table is different in the new book. So this slideshow is different than the one that's posted in terms of recommendations for nursing practice. You can just read that if you are interested. What affects one member of the family affects all of the members of the family. The nurses, it's really the role of the nurse to identify how families are responding to stress. All of the things listed could be family strengths, or they could be areas of improvement for families. So if they are not communicating well, a lot of times nurses can be caught in the middle, and family meetings need to be called, and it's up to us to kind of facilitate the communication and decision making between families. But that is just part of our job. Family assessment data. So you are probably going to look at this and be like, why do I need to know all of this? This is way too much information. I will tell you, this is something that you would need to know in an outpatient setting. In an inpatient setting, it's not going to be as important to know all of this. I did work in public health for a year, and I loved it. And I did maternity care. And everybody always complained about why we had to ask environmental questions. But I'm going to give you an example. And I want, like I have said all along, I want you guys to leave this class thinking about the big picture, not just learning it for the test. So the goal of obviously collecting all this assessment data is to plan nursing interventions that are appropriate. So again, this is probably going to be in an outpatient setting. At the health department, we have this long health history, and it's probably 6 pages, and we ask everybody who comes in. And one of the questions that the nurses hated was asking them if they had well water or if they had public water. Well, if you think about it, if the family is relying, and yes, people in Richmond and surrounding counties do have wells, trust me, and if they are relying on well water, they're not getting the fluoride that they need, so you may have to adjust some interventions for the child. They're also probably getting different minerals that they would not get from public water, that are not necessarily good in well water. So, that one example, such an easy question, and people feel like they're prying into these people's lives, but in order from that basic question, you can develop a nursing intervention. Another one that people hated to ask is if they had a bathroom in their house. And again, this may surprise some of you, but I know people that live in Powhatan County, which is actually in Chesterfield, so not that far away, who still have outhouses. They do not have public toilets in their house. So you really need to think about the interventions and the education and your teaching towards your patients. If they, for example, are having difficulty getting food and they don't have electricity or a stove and all they have is a microwave, and they go to the food bank, are they getting food that they can actually cook, or are they just getting food that will go to waste? So I'll get off my little soapbox, but it is important to assess all of this information, even though it can be daunting, and a lot of nurses don't understand why it's important, but it is hugely important to know what kind of lives your patients live. And you are not prying, like I said, you are doing your job to make sure that you can provide the most accurate and beneficial interventions to these individuals. Culture is a huge part of nursing now, and I think that it's going to continue to grow and continue to impact healthcare. It is learned, it starts at birth, and kind of evolves and adapts as new members are born into the family. Some children may embrace their culture, some children may not embrace their culture, and that can be difficult for parents. And so that is something that, we need to be aware of and look for. There is a difference between race and ethnicity. You need to recognize the difference in your care. Race is just simply skin color, bone structure, genetic traits. Ethnicity, group whose members share unique cultural, social, and linguistic heritage. So if you think about, for example, race, Hispanic, the Hispanic population is a race, and then there are so many ethnicities within the Hispanic population. I worked with in the at the health department, I worked with 95% of my maternity patients were Spanish speaking, and I can tell you that they all had different cultural beliefs, and they all have different ways of thinking. And it's interesting because pretty much where the country that you were born in kind of influences your cultural heritage and things like that, and they all know where what countries each other was born in. It's important for us to culturally assess what's going on, or culturally assess our patients, especially in the outpatient setting. Inpatient setting, you can do a quick assessment. Outpatient setting, you can get more into it. Time orientation is something I want to touch on. And again, this is big picture, and you guys may find this boring, but I have done several medical mission trips in my life. I've gone to El Salvador 3 times and to Africa twice, and I will tell you that time is something that Americans are very stringent on, and it is very important to us. But in other cultures, we used to joke that we were on El Salvadorian time because they run about 2 hours late. They say, "Oh, we'll meet, we'll leave at 8, and then maybe 9:30 we're actually leaving." And as an American, it is hard to let that go. I realize that they are in America, and, we are so time oriented, but really look at, at their culture, even just for time, about when they arrive for appointments or when they hang their G-tube feedings. So time is something that's really valued in America, but is very different throughout the world. And then I want to briefly share this funny story. Complementary alternative therapies, be aware of that. So I was working in the maternity clinic during the eclipse, and all the women were terrified that they were going to deliver their babies early, that the eclipse was literally going to cause them to go into preterm labor. However, their complementary therapy to combat this was tie a red string around their belly. So everybody who came in that day that we did fetal heart tones on had red strings around their belly to prevent somehow it blocked the forces of the eclipse, and they would not go into labor. So again, something that we wouldn't think about the eclipse affecting maternity patients or children, but other cultures do believe that it does. So we need to be culturally aware of that. Nursing management, it is important to know your own values and beliefs, but it's also important to not let them influence your care. You want to avoid stereotyping people. I hate stereotypes. I think working in an ER, it's very easy to stereotype people, and I do not like it. I think that stereotyping people really puts up walls between you and those individuals, and it prevents you from accurately assessing where that family is and what that family needs. Yeah, that's all I'll say about that. You do want to incorporate the family's cultural values in the plan of care and be sensitive to the child and family's cultural differences. There are a lot of resources in the community for families. It certainly is our job as nurses to help facilitate this. A lot of times they don't know that these exist. I don't think the government, and maybe it's because they don't want people to rely on it, but I don't think the government does a great job of advertising and letting people know what is available to them. So it's kind of up to us to let them know what's available. There are some amazing community resources in the area, and if you ever want to talk to me about them, I could talk to you about them for probably an hour, just about what's available in Chesterfield County. There's a great organization in Chesterfield County that's called Families First that deals basically anybody who is having their first child. They will follow you throughout your maternity care and then follow you from 0 to 5 ages and make sure the child is meeting their developmental milestones and getting their immunizations and stuff like that. So there are a lot of programs out there that are probably underutilized because they're not properly being advertised, but we can certainly be an advocate for that. And then this is the last slide. So just think of health overall. Health is not static. It certainly is not static for a child. They are growing and changing more and more rapidly. The reason why good pediatric care is important, one of the reasons, is because there is a relationship between health and development. So if they have a healthy development, they will have a healthier, lifestyle and life in the future. Good nutrition is needed from the beginning. Good mental health is necessary. And then I just want to touch on this. Unintentional injuries are the #1 cause of death in children between ages 1 to 19 years old. So as the nurse, the most important thing that you can teach these parents about is safety, especially with infants and toddlers. Good car seat. Don't leave water around. Don't, leave medicine cabinets open. Don't let them have access to knives. All of that. That is probably one of the most important things that you can do. And we obviously are not doing a great job of it because it has continuously been the #1 cause of death in children. So we need to be better about that. And that is all. Let me know if you have any questions.